So, guten Morgen allesammen. And that is about as far as my Norwegian will go, but odd being Norwegian will probably do better. Really distinguished guests, colleagues, friends, both here in Trondheim and joining us online from around the world. A real pleasure to be here, and congratulations on this important milestone. It's really a pleasure to join you for the launch on what is the first global WHO collaborating centre in this area on well-being and social sustainability. I've got a few warm welcomes. We had a lovely dinner last night. For those of you who weren't there, you really missed a treat. But we really got to know the people that we're going to be working with for the next, we hope, 10 years. So congratulations to the directors of the centre, to Dina and Otter, to the rector, Thor, and to the dean of the university, and really to all the researchers, staff, students, partners, communities whose work has really made today possible and are going to be with us in that journey ahead. WHO Collaborating Centre status is not simply an award or a title. It is a recognition of sustained excellence, credibility, partnership and trust. It reflects the fact that this department is already contributing knowledge and leadership that matters far beyond Norway. And Trondheim feels like exactly the right place for this conversation we're having today, because Norway has demonstrated that prosperity is not measured only by economic growth, but by well-being, by dignity, and by participation of people. And in many ways, the Nordic social model has helped to shape European and global thinking about equity, social cohesion, and human development. And I can't be here from WHO today and not mention Gro Harlem Brundtland, former Prime Minister of Norway and former Director General of WHO, who reminded the world that sustainable development is about meeting the needs of the present without compromising the ability of future generations to meet their own needs. And that idea changed global thinking. And today, this new collaborating centre carries that work forward, asking not only how long people live, but how well people live and together. Because as we heard from Thor, well-being doesn't just happen in isolation, it's built or undermined by the conditions and the opportunities which people have where they are born, where they grow up, where they work, and the wider society they live in. And we know that part of that, the fabric of that, rests in social sustainability. That's fundamentally about people, about fairness, about inclusion, trust, opportunity, and quality of life. And we know from our research already, and the work that we have done already with Dina and Otter, that people thrive when they feel they belong, when people feel they're heard, when people have agency, and when they can participate in shaping the communities around them. One of the documents prepared for today beautifully describes social participation, this foundation of well-being and well-being economy, as social participation transforming people from passive recipients to empowered stakeholders. So that is really not just about good sociology, it's about good public health, and we have the evidence to prove it. And in fact, one could argue today that that is absolutely critical, given that inequalities, loneliness, exclusion, and distrust is really great amongst the public today, and these are the big public health challenges of our time. They don't arrive in an ambulance, they are there in the fabric of our society, and that's where we have to work. So I think perhaps this is one reason why a collaborating centre focused specifically on well-being and social sustainability is so timely and necessary now. Picking up that theme about why a collaborating centre and why this theme now, we talk about the overlapping crisis, conflict, climate anxiety, demographic change, polarization, misinformation, widening inequalities. In that environment, technical solutions are not enough. We need social resilience, we need institutions that people trust, we need communities where people feel connected to one another, and we need evidence to guide action. And that is where the WHO Collaborating Centre plays such an important role. You may be interested to know that across the world, the new Collaborating Centre is joining more than 800 WHO Collaborating Centres. They, for us, are vital. Why? Because they extend the reach and capacity of WHO through research, through training, through innovation and implementation. And we see collaborating centres as places where science meets policy, where local experience informs global thinking, where collaboration becomes more powerful than any one institution working alone. So our collaborating centres, and this collaborating centre specifically, are bridges. They bridge between disciplines, between governments and communities, and between evidence and action. And this collaborating centre is particularly well positioned to be exactly that bridge. And we're launching the collaborating centre at an interesting time where truth, evidence, knowledge is challenged. So I do want to say something about the role of scientists, science, and researchers in this moment. Misinformation is spread quickly, trust is fragile, and evidence is too often treated as optional. But evidence matters because truth matters and scientists matters, not only because they produce knowledge, but because they help societies and organisations like ours and our partners to navigate complexity with honesty and credibility. And in that way, they act as boundary spanners, connecting politics, policy, and the lived experience. And that's very fitting because well-being itself is a boundary-spanning goal. It belongs not to one ministry, it's in health, education, labour, housing, communities, culture, urban design, and civil society. And I think that's really where the promise of this new collaborating centre lies. Not simply producing more research, though I'm sure you will, but helping to create a different way about thinking about progress itself. A way of thinking that asks, are people flourishing? Do communities feel connected? Are systems fair and new innovations improving lives for everyone? And can future generations thrive? They're profound questions, but they couldn't be more important at this time. So today, as we celebrate this launch, we also celebrate a shared commitment to science in the service of humanity, collaboration in the service of well-being, and a belief that healthier societies are built not only through medicine and technology, but through participation, inclusion, trust, and solidarity. To everyone, including all of you who are here to share in this celebration, a huge congratulations. May the work of this collaborating centre inspire not only Norway and Europe, but communities across the world. Tusen takk. Thank you.